Triage is the hardest place to work in the whole hospital. It's the front door, it's the street. And we're the front door to access of care for many, many people. And every patient that walks in the door is having their own emergency.
We see over 200 patients a day in our emergency department. And as a result of the inflow of patients, we're not always able to keep up with the demand for services. And that means that patients spend time waiting.
So in the post-pandemic setting, emergency departments around the country were facing a crisis. And that crisis was really around post-pandemic staffing. We were just really burnt out. On top of that, there were a lot of patients that then came to the emergency department after the pandemic, so we saw our volumes kick up quite a bit. When we admitted patients, we weren't actually able to get them upstairs in the hospital. And so what we saw is that patients would stay in the emergency department and dwell there. This was a huge crisis.
I remember being a newer nurse here, patients would wait 12 hours to get a treatment space. This project was brought about to try to bring care to the front. And how can we help these patients that instead of just sitting and waiting, can we do more for them?
So there were a few signals for the start of this project. Our executive group looks at data. And when they looked at data, they saw that our left without being seen rate was an outlier when compared to hospitals around the country. And I had this unique opportunity to join with what's called the Kaizen Promotion Office. We spent 3 months really analyzing what is going on, looking through and saying, what is the value of changing things in triage? And we did that with getting patient data from satisfaction surveys, looking and gathering a bunch of staff comments through surveys at the huddle board, just having a prompt. What are your ideas to improve triage? And then having little sticky notes where people could put those up. We put these things on a pick chart, and you could see instantly there was like a few key things where all the green dots were on our pick chart. And that really helped guide me for the next 2 years on how to propel the team on what to focus on. And what we came up with was that, the cavalry is not arriving. We're not getting necessarily more staffing or more funding. So what can we do together that's going to solve this problem of our patients leaving without being seen?
One of the things that we did was definitely put the nurse practitioner, put a provider up front pretty much all the time. That made a big difference to start care in the waiting room. One of the most important things we did was we established a triage team lead. And that basically means that of all the triage nurses, one of them's job is like a mini charge nurse. One of them knows all the open beds in the emergency room, pays attention to the acuity or some other situation with the patient, where might it be best for them to go, make sure the nurses get their breaks, helps get the medications, helps discharge people. It's a lead for the area, and that's made a tremendous difference to flow and, I would say, staff satisfaction. We also have a special place where the medical evaluation assistant can do EKGs and blood draws. And we have a provider room. We have a place where if we have another provider who can actually spend the time to do a full visit. So we're doing much more comprehensive care with a team that has roles defined that works. And we have sort of, subtly refined it along the way. And now it's a pretty well-oiled machine. One thing that I'm really proud about is that we probably see on average 200 patients a day. And on many days, we discharge about 30. That's a huge percentage of patients that not only got in and out from the waiting room, but also saved the beds in the main part of the emergency department for people who are really sick and really need the resources that bed provides.
I think the main thing that this project actually illustrated was it gives a blueprint for how to do improvement work throughout our hospital in the post-pandemic era.
I always focus in on staff satisfaction. I think that in order to take care of patients well, the staff has to feel like they are heard, listened to, and supported. And a happier staff does better patient care.